This video will describe the performance rating standards and their application in the practicum setting. The student's performance is evaluated based on their level of competence at the end of the placement using the performance standards that we'll describe later on in this video. Growth and learning throughout the experience is expected. It is also expected that there will be an ongoing exchange of ideas, feedback, and collaboration between the student and the preceptor. A key point to remember is that competence is an observed behavior. What that means is that as a student, you will need to show your preceptor you are competent through your words and actions. You need to participate in and contribute to the practice activities of the preceptor. What this means as a preceptor is that the student needs hands-on practice activities and that you directly observe a student's performance in order to assess their competence. In order to meet the program and registration requirements, students need to demonstrate competence across all performance indicators. That is to say, they need a competent rating on every item. Each placement context is different, so having a competent rating across multiple placements is important to demonstrate your overall readiness for dietetics practice. The preceptor maintains ultimate responsibility for the dietetic practice undertaken by the student, be it in the nutrition care of the patient, in the group, or of the project. The preceptor is also responsible for ensuring that the student is not assigned functions and tasks that they are not competent to perform. The preceptor has a responsibility to observe and supervise the student appropriately to evaluate their performance of the various skills and activities. It is also important to distinguish between supervision for the purposes of evaluation and supervision as described in the rating scale. If a preceptor observes a student performing an activity and does not need to intervene, guide, or direct the student, then the student can be deemed to have completed the performance indicator competently. The preceptor's direct or indirect supervision was necessary only for the purpose of evaluating the performance of the student. If a preceptor observes a student performing an activity in which the preceptor must intervene to provide guidance or direction, then the student's rating would be either supervision or minimal supervision, depending on the amount of guidance required. The performance rating categories are NA or not applicable, E for exposure or discussion, S for supervision, M for minimal supervision, and C for competent. In more detail, not applicable means that this activity was not part of the placement experience. Exposure describes experiences at the exposure level only. Students may have observed or discussed activity, but not performed them independently. Supervision describes experiences at the hands-on practice in performing an activity. However, the performance is directed by the placement preceptor through prompting and guidance or discussion of issues. A student at the supervision level requires assistance identifying relevant data. They focus on objective data and do not consider the context or big picture. They require significant guidance in situations where rules do not apply and require explicit instructions to complete tasks. They may make numerous mistakes and require extended periods of time to complete tasks. Their written work requires a substantial amount of editing for grammar, spelling, flow, and/or ideas. Minimal supervision describes practice activities that are hands-on. Students at minimal supervision level are able to identify most relevant details, but may require assistance to identify, interpret, and prioritize data and tasks. They begin to apply learning from previous experiences. They take some initiative in performing routine activities, and they rely on guidelines. They may need help prioritizing to complete tasks, and they lack speed and flexibility. They will need help establishing a new plan if the original plan fails, and their written work requires a moderate amount of editing around grammar, spelling, flow, and/or ideas. At a competent rating, it is expected that there will be an ongoing collegial exchange of ideas, feedback, and collaboration between the student and preceptor. This is normal practice and is highly desirable. At a competent level, a student is able to consistently identify and interpret key aspects of an issue, skill, or situation. They consistently apply practical knowledge from previous experience and learning. Their planning includes prioritization and is based on critical analysis of the problem or situation. They're conscientious and respectful of context and timelines. They're able to recognize their own limitations and seek guidance as needed. The students' actions are based on person, community, and/or group-centered goals, and their actions and interventions are ethical and safe. The student presents no risk to the public. They follow organizational guidelines and policies, and they are improving in their speed and flexibility. Their written work is clear, well thought out, and well edited. A student may demonstrate non-competent behaviors. These behaviors look like this. They may make errors without recognizing them or learning from them. They may avoid or not make decisions. This student is not able to work collaboratively and doesn't ask for help when needed. They may demonstrate inappropriate communication skills and practice unethically. They are not receptive to advice and constructive criticism. They lack knowledge and skills and do not pursue further learning. They may lack the ability to recognize their self-limitations and knowledge deficits. If you have concerns that your student is demonstrating these non-competent behaviors, inform the student's dietetic education coordinator so that quick action can be taken to address these behaviors. What does demonstrating competence look like? This video will conclude with a few descriptions and examples of the various performance ratings across some common placement experiences. In a clinical setting, consider Performance Indicator 3.02b to prioritize nutrition care goals based upon risk and available resources. What are we asking the student to do here? We're asking them to describe the process to determine nutrition risk, to describe the available resources to support the nutrition care goals, and to recommend and justify the rationale for the nutrition care goal priorities. Students at a supervision level require the dietitian to guide and prompt a discussion on considerations when prioritizing the patient's nutrition care goals. The student does not consider or is not aware of the internal and external resources available to address the nutrition care goals. With substantial guidance and prompting from their dietitian, the student may identify some of the nutrition care goal priorities. Students at the minimal supervision level are able to identify the priority nutrition care goals some of the time and with some guidance or prompting from their dietitian preceptor. They consider the available resources with some input from their preceptor. A student is competent if they're able to consistently identify and justify the priority nutrition care goals when discussing the patient case with the dietitian. They consider the risks and the available resources. Priority goals are the most important or the acute or high-risk issues only. Competent does not mean that the student will consistently identify and address nuanced nutrition issues that a dietitian with years of practice in an area would identify or address. This is expert practice and is beyond what is required at entry to practice. Consider a placement in an outpatient setting. A competent student is one who is able to conduct a counseling session safely and effectively with indirect supervision from their preceptor. Indirect supervision might look like this. The preceptor is available at the start of the session when the student and patient first meet, but then excuses themselves from the session. The student may step out of the conversation with the patient to check in with the preceptor before implementing the nutrition care plan. The student is able to describe the issues and justify the care plan to the preceptor with minimal or no input. The preceptor may check in with the patient at the end of the session to ensure all their concerns have been addressed. No concerns are identified, and there are minimal additional patient questions that come up. The student documents the patient encounter, and the preceptor has minimal or no concerns with the content or format of the documentation. This example also demonstrates the many competencies and related performance indicators that connect and apply with one practice activity, such as conducting a counseling session. Thirdly, we'll consider the performance indicator 5.02L, obtain and interpret stakeholder perspective. What are we asking the students to do here? We're asking them to identify who the stakeholders are and to describe methods of obtaining stakeholder perspective. We're asking them to collect relevant stakeholder data and then consider this perspective in the dietetics related project, program, or service. At a competent level, the student is successfully able to identify, collect, and thoughtfully integrate the perspective of the stakeholder in the dietetics related project, program, or service with minimal direction or input from the preceptor. For example, the student may use quantitative and qualitative data from patient satisfaction survey to obtain the patient perspective. Using this information alongside with data provided from the finance department, food service job descriptions, and a nutritional analysis, the student interprets this information to provide suggestions for improvements to the hospital menu.